In this video, I am going to talk about the pathogenesis of pelvic inflammatory disease, that is PID. So what is a pelvic inflammatory disease? So this is infection which usually affects the female reproductive system, which involves the lower genital tract or the upper genital tract, which includes the vagina, the vulva, the uterus, the ovaries, and finally the fallopian tube. So in this video, I'm going to talk about the pathogenesis of pelvic inflammatory disease. So to begin with, what is a pelvic inflammatory disease? So this is infection of the female reproductive system. It is characterized by inflammation of a woman's reproductive organs, that is the ovaries, the uterus, and the fallopian tube. So it is generally a scandin infection which is spread from the lower genital tract, that is the vulva and the vagina, to the upper genital tract, that is the uterus, the ovaries, and the fallopian tube, which is caused by an infection. So the disease is more common in women who are aged between 15 to 25 years old. So we have two types of PID, that is acute pelvic inflammatory disease, and we have the chronic pelvic inflammatory disease. So in the acute PID, there is a sudden or severe inflammation of the reproductive organs, that is the uterus, the ovaries, and the fallopian tube, which is caused due to an infection. We also have the chronic PID, which is characterized by a persistent inflammation to the genital tract, that is the ovaries, the fallopian tube, and the uterus. So which can lead to severe complications if left untreated. Okay, what about the cause of PID? So generally PID is caused by a number of infections, which include sexual transmitted infections such as chlamydia trachomatis and Neisseria gonorrhea. Okay, if there is a infection of the vagina, that is bacterial vaginosis, and if there is a ruptured appendicitis, or if there is a history of surgical procedures, for example, permanently clipped or blocked or removal of the uterus. So these are the number of infections that can cause of PID. What about the risk factors of pelvic inflammatory disease? So risk factors are any factors that may alleviate the pathogenesis, the development of this disease. So we have a number of factors that are the risk factors of PID, which include an STI, that is sexual transmitted infection. Number 2, having multiple sexual partners. Number 3, sexual active women who are aged between 15 to 25 years old, or if there is a history of surgical procedures, for example, clipping, blocking, or permanent removing of the uterus from the reproductive organs. So these are the risk factors of PID. Okay, what about the symptoms? How will you know if you have the PID infection? So generally, the PID infection can cause a vaginal discharge, which can look like yellow, green, white, thick discharge, which can be smelly, fishy odor. So that is number 1 sign of PID. Okay, number 2, you may experience abnormal vaginal bleeding if you have a PID. Third, you may experience dyspareunia, that is painful during sexual intercourse. So if you have a PID, you may experience painful during sexual intercourse. You may also experience a chronic abdominal pain. So if you have a PID, you may have a chronic pelvic pain, especially pain in the right upper part of the abdomen. You may experience pain in the abdomen. That is another symptoms of PID. Okay, you may also experience dysuria, that is painful urination. You may also experience bleeding before, bleeding after, bleeding and spotting after sexual intercourse. So these are the common symptoms. You may also experience high fever, that is high body temperature, when you have a BID. Okay, how can BID be diagnosed? Your doctor or your physician will perform a number of diagnoses for him to confirm if you have a pelvic inflammatory disease. Number one, your doctor will make a proper medical history taken. If you have a multiple sexual partners, if you had a history of BID, or if you have a history of surgical procedures, so your doctor will do a number of history taking to confirm if you have the infection. Secondly, your doctor will do a pelvic exam to confirm if there is tenderness around the uterus or if there is a vaginal discharge. Your doctor will do a pelvic exam. Your doctor will also perform a blood test to confirm if there is presence of infection. Your doctor will also do a urine test, that is urinalysis, to confirm if you have any infection in your urogenitals. Your doctor will also do a pelvic ultrasound to confirm if you have any defects or any abnormalities in your reproductive organism. Your doctor will also do a laparoscopy. So this is a procedure in which the healthcare profession will do an incision in the abdomen to see the internal pictures of the reproductive organs to confirm if you have the infection. Okay, these are the number of diagnoses that your doctor will perform. What about the differential diagnosis of pelvic inflammatory disease? So there are a number of diseases which which is similar to BID, that is pelvic inflammatory disease. So the first one is ruptured appendicitis. So if you have a ruptured appendicitis, you may have the same symptoms of BID. Okay, the other differential diagnosis is ovarian torsion. So if you have a ovarian torsion, you may experience the similar symptoms like the one of BID. Your doctor will also confirm a differential diagnosis if you have an endometriosis. So endometriosis is a condition whereby the lining of the uterus, the lining of the uterus grows outside the uterine wall. That's what we call endometriosis. And you will also have, maybe your doctor will also do a differential diagnosis of a pyelonephritis, that is an infection of the upper genital tract, infection of the urinary system. And there will be also a differential diagnosis of diverticulosis. Yeah, that is diverticulosis. If there's infection or if there's a blockage in your abdomen, in your stomach. So these are the differential diagnosis in which your doctor will do to confirm if you have the infection. Okay, what about how can you prevent the infection? So you can prevent the infection maybe if you limit sexual intercourse, or maybe you have to limit your sexual partners. So you have to avoid having multiple sexual partners. You may also need to get tested, because if you experience that you have the disease, you must go to a doctor and get checked if you have the infection. Thirdly, and there's maybe you have to use condom. So you have to use condom whenever you want to do a sexual intercourse for you to prevent not getting the infection. Okay, your doctor, you must also always visit a healthcare or maybe a doctor for you to confirm if you have the infection. Okay, what about the treatment? Okay, in BID generally there is a possible antibiotic which is used to treat the BID infection. For instance, your doctor may prescribe an oral drugs, that is doxycycline, PO doxycycline 100 mg BD for 2 weeks. Secondly, flagyl, that is metronidazole 400 mg BD for 2 weeks. Your doctor will give you a starting dose of Cefixime 400 mg, or your doctor will give you a starting dose of ceftriaxone 250 milligram, that is IM, start a single dose. So your doctor will also prescribe for you azithromycin and 1 gram start. So there are many possible antibiotics which your doctor will use to treat for you to eradicate the infection of pelvic inflammatory disease. So what about the complications? So when you had a BID, you may experience a number of complications such as an obstruction, permanent obstruction or blockage in the fallopian tube, that is ovarian abscess. You may experience infertility. So BID is the number one cause of infertility because it blocks the fallopian tube. So once the fallopian tube is blocked, so there is no way the sperm to travel through to the uterus for fertilization to occur. No, because if you have BID, there is a blockage in your reproductive organs. Therefore, you may experience infertility, difficulty conceiving. Number two, you may experience an obstruction or blockage which can cause maybe a fluid buildup in your ovaries. That is what we call polycystic ovarian syndrome. So there's a fluid sac which grows around your uterus. So this can also disrupt the normal functioning of the reproductive organs, maybe affecting how these organs are working. Maybe they can cause hormonal imbalances. Therefore, it's difficult for you to get pregnant. Number three, you may experience a long-term chronic pelvic pain. So if you have a BID, you may experience a long-term chronic pelvic pain. Okay, another complication which you may have is ectopic pregnancy. So in ectopic pregnancy is a pregnancy whereby the fertilized egg grows outside the uterus. Therefore, your pregnancy will occur outside the uterus. This is what we call ectopic pregnancy. So these are the number of complications you may experience if you have a BID. So it's good for you to visit your doctor or your healthcare physician to get checked if you have the infection. So please, if you find the video helpful, kindly hit the subscribe button, like and share, and give your comment to this video. Thanks for your watching, and see you in the next video.